Hello, in this video we will understand about the vaginal yeast infection. It is also known as the fungal candida. So what is this? Let's begin to understand. So basically it's an overgrowth of fungal candida cause a vaginal yeast infection, while the normal microbiota will not problem. So let's begin to understand the an overgrowth of fungal candida cause a vaginal yeast infection, while the lactobacillus will inhibit this overproduction due to the production of hydrogen peroxide as well as lactic acid. Remember, but on the other hand, this is the reproductive system of female contain fallopian tube, fimbriae, and ovarian ligament as ovary also and uterus used for the growth of the baby, and the vagina are present, the cervix, and outer region is known as the vulva. Outside part will affect is lead to cause itching and inflammation as well as swelling due to the vaginal yeast infection. Let's understand about the microbiota in the vagina. So the microbiota in vagina is 50 types of species of bacteria as well as yeast, which that will lead to affect and beneficial as well as harmful effect. But this is a yeast infection will lead to produce the cheese swelling, consistency of cottage cheese discharge, and swelling and redness and pain during sex. The microbiota in vagina, which that will lead to burning, itch, vaginal discharge, and many more things. So the candida imbalances inflammation of the vagina. The vaginal yeast infection will cause. And in this way, the symptoms, let's begin to understand first, but we will understand about the other things, the risk factor. But first of all, we should need to understand the other things, the balanced yeast candida, no cause any problems. Yeast who live in your skin, mouth, digestive system, and in vagina is called candida and normally not cause any problem. But the common after puberty and before menopause, so it can cause problem, and up to 75% women or people assigned female at birth will have at least one vaginal yeast infection in their life. Anyhow, I hope you make sense. The up to 75% women are during the puberty and assigned female at birth also will have at least one vaginal yeast infection in their life. So, what is the risk factor? Let's begin to understand. The major risk factor is using the antibiotics. When we will use the antibiotics, will kill the microbiota in vagina, will lead to infection increase of the yeast increase because the antibiotic will resist if the yeast. But on the other hand, the birth control pills as well as steroid, because estrogen and progesterone will lead to increase the growth of the yeast, weaken immune system, and being a pregnant as well as diabetes also can affect the yeast infection. Anyhow, let's begin to understand the imbalances. Whenever the lactobacillus, for example, there is a lot of bacteria, but we are taking the example as a lactobacillus, produce hydrogen peroxide and lactic acid, lead to pH maintenance in the vagina, will maintain the yeast infection due to the normal growth and balances. While the however, certain factors make it hard for the good bacteria to fight off the bad bacteria. Sometimes the bad bacteria win and you end up with an illness. Anyhow, the vaginal infection can be recovered easily. This is the lactobacillus produce hydrogen peroxide and lactic acid will inhibit the overgrowth of the yeast, the candida. Let's begin to understand the symptom. Symptom is that an itchy or burning sensation in your vaginal and vulva when pee, a thick white vaginal discharge with the consistency of cottage cheese and swelling as well as redness and pain during sex are also the sign and symptom of the vaginal yeast infection, the fungal candida. This is the what is thick coated cheese like vaginal discharge, redness, and irritation. So I hope you make sense about that. Let's begin to understand the diagnosis. The diagnosis is the discharge sample we will take, and in this way, the slides preparation for multiple slide preparation lead to microscopic study to identify the candida yeast overgrowth. If the overgrowth will be identified in this way, we can say that the vaginal yeast infection confirmation. A lot of treatments can be used for the vaginal yeast infection, like antifungal medication, oral one dose of fluconazole, and topical is the daily use. Others medication like miconazole and terconazole, and avoidance of sex even protective also. On the other hand, let's begin to understand further things. Because it can transmit the disease, the fungal disease, to another person, let's begin to understand the prevention. Don't use the fragrance contained pads and changes wet clothes often, and wearing cotton underwear and blood sugar level in normal range should be, which that will protect and which that will be control the vaginal yeast infection, the VYI or fungal candida FC. There is a microbiota, remember. So I am again describing about the vaginal microbiome. Some lactobacillus and other bacteria plays important role to protect infection of yeast, and bacteria produces defensin as a mutualism with individuals, and in this way the protection against the infection of the fungi, the fungal candida, will lead to protect, and in this way the microbiota play important role for the control of disease. So the prebiotic and probiotic can be used to cure this vaginal yeast infection 100%, and uses the prebiotic and probiotic for protective mechanism to enhance the inhibition of the vaginal yeast infection.